बाजारात लॉन्च होत असतात आणि ते पाहून आपल्या गोंधळात भरच पडत असते. आपण आपल्या प्रॅक्टिसमध्ये त्याचा वापर करून घेऊ शकतो. तसा ते आपल्याला सांगतील आमचे फोन गुरु डॉक्टर कुलकर्णी. या सेशनसाठी
नमस्कार मित्रांनो.
माझं नाही.
I know we are tail enders in a T20 match. We try to finish the innings as soon as possible. Dr. Kulkarni, Gopya, according to me and according to his friends, has done family medicine. I think he can lead the profile. Right now he is working with one leg in Raigad and one leg in Kulkarni. Only good thing about him is that he is very enthusiastic and he has a tremendous teaching potential. So it's a blessing for all the new doctors in making. And he has done a lot of work in industrial medicine and preventive medicine. I think I will not go further. Because the topic is non-medical, but it's very important because I think sitting in this auditorium, you can reach any person in the world right now. So I hand it over to Dr. Kulkarni.
Thank you, Dr. Patel. Thank you, audience, for waiting patiently in a very humid atmosphere. When I decided to talk about this topic, I thought that I am talking about future of community medicine, which is available, affordable, as well as accessible. Why this topic of smartphones? Friends, this gives you information at point of care. Multitasking, complicated things are made easy. It improves your communication at a moment. Clinical health at crisis time, whatever Dr. Ganguly is talking, you just prepare one group or you add your local doctors in WhatsApp. At 1 second, all your 50 doctors will be reached that they will ask to come at one particular place. And access to the database so that you can practice evidence-based medicine. But unfortunately, smartphone is misinterpreted by anybody in the family. It's like an elephant. Somebody will take as a video, somebody will take as an audio, somebody will take only for photographs. But for doctors, this is one of the most important friends which we should not miss to use. What are the advantages? It saves time, repetitive tasks, eco-friendly, less paper is consumed, quick speed, cutting edge or others, helps for documentation and research and evidence-based medicine. In the next 10 to 15 minutes, I am going to just tell you about basics about the technology, what are the programs and applications, how you can utilize in your OPD services, IPD, research and database management, what are the various formula, applications and calculators, and please don't take anything from the notes. This presentation is going to be available on our blog just after the meeting is over. Don't take them. So this is exactly like what is technology. 1/8 we know, 7/8 we don't use. You have got everything, this friend in your pocket. It's a mobile phone, it is on a mobile computing platform. It is a portable media player, audio, video. It is a compact digital two-way video camera so that you can do video conferencing. GPS, global positioning system. It tells you where you are. It has got a high resolution touch screen and it can browse the World Wide Web fast. It can work both as well as on the card as well as on the Wi-Fi. Which smartphone should I buy? That is the commonest question which is asked after this presentation. You should buy a smartphone which has got a display called as an AMOLED display. At 12 o'clock in the afternoon, you must be in position to see the screen. The processor should be dual core and fast. It should have good connectivity, 2 cameras. Storage should be maximal expandable. And there is certain phones which have got a voice recognition. Means there is a program called as Siri. You just open Google Map and tell them I want to go to Rishivan Resort, Khopoli. It will detect your voice and it will show you on the map where is Rishivan Resort, Khopoli. There is certain do's and don'ts. Don't buy almost a new model. Please have an antivirus. If you are traveling abroad, don't use Indian connection. Please close the running applications. And there is something called as an Android booster which helps to optimize the use. And what is the law of obsolescence? Don't ask for any latest model because the moment you turn your back, the model has become old. And now there are smartphones which run with lot of applications. I just give you a few examples. There are solo or single use applications like a BMI or body surface area calculator, lab values converter, IV drug dose calculator, 4 medical journals of CPR. These are one condition only and then they describe. But there are bundled packages which are very famous among doctors like Medscape, Hippocrates, Skyscape, e-medicine and UpToDate. The Indian version of the same is called as the Ashwini, and there is one more Indian medicine available called as M-medicine. Now you go to Google Play Store or you go to Android, you go to the iPhone application store. This is called as iTunes, and there are many applications are there. What are the criteria? You just see who has created the application, what is the credibility, whether it is a creative or competent, does it communicate to other applications, and how many people have consumed it. You always give a star. The moment you open any Google Play Store, and suppose if you want to know a diabetes management application, there are stars. The star can be 3 star, 4 star. If it is less than 2 star, don't take that application. This is what happens. You purchase 100 applications in January and you end up using only 4 at the end of December. So don't do like that. At the same time, there are a lot of applications who are going to use to your secretarial staff or your assistants. Appointment scheduling, two-way communication, patient database, greetings, or even making the payment online. This is a typical screenshot of an appointment scheduler. You can have 2 appointment scheduler, one for your medical job and one for your household job also. This is something very innovative. It is called as a dot pulse or M token. If you are a very busy practitioner, you are not supposed to take down the appointments. This website does it for you at a very nominal cost. And it gives you on a smartphone telling that you have got 10 patients in the evening from 6 o'clock to 8 o'clock and they are placed at a 6-minute interval. And this is a free application. Suppose if you are very busy, somebody like Dr. Dabarkar who is really moving all around the district as well as the state, you can have a very expanded scheduler like this, and then he can tell this, I am not available on 17 days out of this next month. This is what is the future concerned waiting room of any clinic. The iPads and the tabs are going to replace the papers, and these applications are worth trying, at least on a trial basis in Europe. Now what is your good for staff, residents, assistants? It keeps your primary data. If you are managing a patient of obesity, it takes body mass index immediately. Reminder like allergies, deficiencies, you can have own set of contraindications and interactions. And there is something called as a dictation software. Means you talk to the software, you talk to the smartphone, it is connected to your main PC, and it can print whatever you have talked to them. It is important for all the radiologists and pathologists. And I think half of the audience must be using this application called as a WhatsApp. There are a lot of self-learning and evaluation diagnostics. This will be useful for the medical students. There are a lot of equipments in an iPhone, like eye torch, eye stethoscope. It has got a built-in scanner. You did not do anything about your patient's report. You just scan. It has got a visiting card reader. And some of the most important thing is, suppose Dr. Patel is here and he wants to know what is happening into his hospital right now. In his Android or iPhone, he can watch his CCTV. It is very useful and a very wonderful application at a very negligible cost. Imagine your table. You have got hundreds of visiting cards on your table. There is something called as a CAM card which organizes the visiting cards. And this is a remote control which I am talking about, Dr. Patel, who can watch his hospital from an iPhone. This is the eye stethoscope. You just attach an additional instrument to that and you can get a fantastic resolution of heart sounds and the respiratory sounds. This is called as a mobile phone pulse oximeter. It gives you instant heart rate as well as the oxygen concentration. This instrument is called as a cell scope. You put it in front of a skin lesion, the photograph is taken, and then you can refer it to a daily dermatologist of your choice electronically and get the answer. And this is called as a QBC. It is a method for detecting the malarial parasites in the remote area. You can use a phone as a microscope and the smear can be reported by the pathologist. This is called as a cell phone based fluorescent imaging and sensing platform. You have an epidemic of gastroenteritis in some jatra and you want to know what is the source of E. coli. So just put that one sample of the urine and this phone will tell which contains which organisms. These are the mobile diabetic devices used for diabetes management. This is called as a glucophone. It's a glucometer plus smartphone, and the moment blood sugar is done, it can display to the 5 different people, to the doctor, to the caregiver, and to the person who is helping this gentleman. If you want to know whatever the things are happening in the diabetic's life, there is a program called as a glucose buddy. It tells you the excursions of blood glucose, and this is something really fantastic. It is called as a well-challenged examiner. A standard fundus camera costs 10 lakhs of rupees. This costs only 40,000 of rupees. But for all my diabetic patients, it is very useful because it takes the picture of retina, and the retina picture can be transmitted to any of his relatives or ophthalmologist who is either in US or UK and is worried about his vision. And this is a typical Indian invention. Miskin Ingole is the name of the scientist. And he started using a sensor. Without taking a blood sample, you can take a hemoglobin. And that is a handheld, needle-free, battery-operated screening device for anything. This is called as a Netra, as a near-eye tool for eye assessment. It can give refractory error, it can give you color blindness, presence, absence of cataract. Oral cancers are very common in India. This is a program called as O-Scan, which is just attached to the smartphone, and it can detect the amount of the area of cancer as early as possible. Now in OPD as physicians, we get lot many patients. Somebody is admitted with a heart attack, and the other fellow wants to know, I want to know what is my risk of getting heart attack or a stroke. And this is a program called as a Framingham CV risk. If you see on the screen, the age is 50, BP is raised, cholesterol is high, HDL cholesterol protecting is low, he is a smoker, he is diabetic. The moment you tell that you control your values, if you see the first line, there is a risk of 62.6% in developing any major cardiac event. This is called as a MACE, M-A-C-E. And if he manages his all the risk factors, his risk is reduced to 22%. This is a good motivational tool for our patients to change the lifestyle in a very therapeutic way. These are various medical calculators which are available depending upon your specialties. Like what Dr. Gangolia asked, is there any method by which you can predict the renal function decline, and that is called as the eGFR, and which can be calculated by these calculators. The name of the calculator is called as a QX calculator. It is a free application. Now you get lot of lab reports. This lab report tells you how to convert from the standard limit into international limit. Not only that, if you want to teach somebody, you have got staff, and you want to tell them that this is the way a lymphocyte looks, or a neutrophil looks, or a malarial parasite looks. These all programs are available in Google Play Store, and you can download at a very nominal cost. I will request you to download the programs which are about 100 or 150 rupees cost, because then after they give you not many free programs. Now you have got something to know about drugs. This is called as a PDR, Pocket Drug Reference. And if you want to know about the drug, everything is given about the drug in this program. But something which is more important, more sensitive and more reliable is called as a micromedics. This is a wonderful application. All the information about the drugs are given, and a time may come that you have a phone with you and you just put the scanner and then tells you what the tablet contains. This is according to the new regulations of government, and after few months, all our medicines are going to be like this. You are using a drug like Presidex. It is a sedative, but you want to know more about it. It is available in a single application. My patient is in Zambulpada. He is in a Vruddhashram, and I want to know whether he is suffering from a heart attack or not. And this is the application called as a telephonic ACG, which I can analyze very easily and tell the doctor treating there that whether it is infarct or not. If you want something more sophisticated, this is called as air-strip cardiology. Air-strip cardiology is approved by the US FDA also. Suppose if you want to know about the procedures, there are a lot of procedures. 400 procedures are there in clinical medicine approximately. But all these multimedia are available in this program called as a procedures consult. And you can keep the whole site and you can do the procedure. It is that reliable and that authentic. Airway intubation is one of the biggest problems for anesthetists for the emergency medical people. Then how to get trained about it? This is called as a URVL, upper respiratory virtual lab. You can virtually see the larynx of different sizes and you can try intubation according to that. You have got a radiologist friend, suppose Dr. Pramod Gandhi wants to know what is the status of his head injury patient, which he has just left seen at 4:30 in the evening. This is called as a mobile MIM, mobile instant messaging radiology. When the relative comes to Dr. Gandhi, he can say that yes, I have seen your CT scan or MRI in this particular source, and this is the magic of technology which is available in your pocket right now. Suppose you have got a children in your family who are medical students and they are bored about learning about muscles and bones. These are wonderful applications called as a muscle trigger or skeletal system Pro 3. It can even give you a 3D implication of your body. It can tell you all the foramina in the skull which have been troubling us for our rest of our first MBBS, and they will tell you all the structures also. There is something called as a Visual DX. It is a visual clinical decision support system. You can post your picture on the internet at this site, and the closest available differential diagnosis you can pick up, and it will help from knowing the disease condition and further treatment. You are tired of writing prescriptions, then this is called as a I prescribe or a doctor chemist patient interrelation. The days are not long when you are sitting in your clinic, you have typed a prescription on your mobile, it goes to the chemist. The chemist is already taken out the medicines for the patient. He just writes the card and he walks away with the medicine with all the directions and all the things given in a very legible capital English handwriting format. There is another one called as a prescription writer. It can generate your prescription according to your choice of drugs. You can have your own set of drugs. Suppose if you want to favor a particular company, then you can write the drugs at their first choice. If this is not available, then they can go for the second choice. Whatever I talked to you was all available from US or UK. What is in India? You can go to a website called as mmedicine.mob. M-medicine, M is small, medicine and .mobi. And you just send an email to a person, his name is Amit, that you want activation of this website. He will give you activation free of cost for 1 month. For research publications, this is a Pandora's box. You can do anything. You can have guidelines like NICE guidelines. NICE guidelines are the national guidelines for the clinical excellence. This is the National Institute for Clinical Excellence based in UK, and you can find out guidelines according to all the conditions. It's a very easy way to stay up to date in the fast growing medical world. This site called as a Medicine Core Journal. You can get all the 12 top medical journals at the click of your button. You can get fantastic journals like this, New England Journal of Medicine, supposed to be a Gita or Bible for all the physicians. You have got a student, he wants to remember all the name short forms, and this is part of the eponyms or mnemonic application. Now let us go out of our clinics, out of our labs. You go to a conference, a big conference like what I attended in Berlin. More than 25,000 delegates, and the complex was 2.5 kilometers by 1.5 kilometers. Suppose if we 6 of us are walking with the same smartphone application, they can be shown as a red dot, and we can decide which particular session which we want to attend. The days are gone when you have to attend the conference, and I promised Dr. Nagargoje that our next regional CME will be webcasted live to all the RMA members, and they can be in a position to access it anytime as archive also. So, Medscape and Hippocrates are the two very wonderful applications. You have to go into the details and try to do some self-learning. Skyscape and up-to-date. Skyscape, one thing which I want to tell you, is developed by our Indian IITian, and this gentleman is from Karad, and this is one of the best selling medical application on software platforms. M-medicine has got lot many things. It has got calculators, drug list. In drug interaction, suppose if you are using aminophylline and azithromycin and a drug for arrhythmia called as amiodarone, then it will give you a click that this patient may have a prolonged QTC. There are a lot of patient management applications, clinic to go, doctor or move, or ingredient for doctors. For patient education, human anatomy, animations. Suppose Amit wants to tell about dialysis, you can show the video, insulin injection techniques, and triage in case of a big accident. Diet prescription is a boredom for everybody. You have got an application called as a loose sleep. You have got fantastic image collections from Frank Nichols Image for education. Suppose if you want to learn CPR, this is called as a CPR iPhone. It tells you the basic steps, external compressions. In emergency medicine, you can use NHS symptom checker and you can decide whether the patient is really serious or not. You can improve your quality of life while doing exercise. You can import a pedometer, exercise animation, relax melodies. You can combine yoga and a site called as a TED, that is a technicality, entertainment and design. It will give multiple number of scientists who have given presentations on smartphones. Last but not that unimportant things. You shift from place like Khopoli to Raigad, nobody knows you. Put yourself on Google Map and the person types Raigad Diabetes Heart Care Center. He gets a map, he tells his position at Vashi station, and he gets a map from Vashi station how to reach my place and how much time he is going to take, how many routes are there, whether there are tolls or not, and what is the condition of traffic on that. This is from Google Map. It is absolutely free. Friends, in a very hurried way, I have tried to tell you whatever little I know about smartphones. But before we close this chapter, please remember that opportunities are endless. It is up to us to how we take and use it. Please respect your teachers. Please respect the experience and clinical wit. And those who are from Miraj Medical College, who will be recognized these two gentlemen, Dr. Soltur and Dr. Sanpur, who are our teachers. Friends, please remember that technology changes, advances are welcome. But human touch, rational thinking, clinical acumen, empathy are not technical. They have to come from your heart and brain. And those skills will always win. So please combine always your modern technology and clinical skills. Do not forget to use your peripheral, rechargeable, expandable, portable, handheld and very cheap costed peripheral brain. And if you need any help, I am always available in Khopoli or in Navi Mumbai. Thank you very much for your patient listening. And if you have anything to know about this, you can mail me or you can give me a SMS. I will be more than happy to answer all your questions. Thank you very much. And this is a topic of real new generations. I must thank Aditya, my son, who has prepared almost half of this presentation. And you also learn from your children or grandchildren, whoever else. Thank you very much. Thank you.